Hello, I'm Dr. Pierce of my neurology clinic. I am located in Sugar Land, Texas, um, and I will be talking to you today about dementia. Many people have heard about the term dementia, but don't really know exactly what it is. So it's a general term that we use um, to group of to group neurological disorders that cause memory loss and cognitive impairment. So many people think that dementia is a single diagnosis. However, there are several neurological disorders that can lead to dementia. The most common one that most of you guys have probably heard of is Alzheimer's dementia. Um, Unfortunately, African Americans have the highest prevalence of Alzheimer's dementia and related disorders. Alzheimer's disease is caused by the buildup of protein in the brain, especially in our memory areas. It first starts to build up in our memory areas such as our hippocampus. Um, this protein is called beta amyloid and tau protein. They build up and form tangles and plaques in our brain, and this causes basically destruction of our brain and shrinkage. So ultimately, it's a neurodegenerative disease. So it basically progresses over time. It gets worse and worse. Currently, there is no cure. However, there is current research that is happening right now and soon to be on the market. There may be a medication that will basically reverse the signs of dementia. So I'm looking forward to hearing more about that. Stay tuned. I will let you know once that hits the market. So we have Alzheimer's dementia. It overwhelmingly affects African Americans. Then the second most common is vascular dementia. Vascular dementia is caused by overall an unhealthy lifestyle. So people who are living with long-standing high blood pressure for several years, diabetes, kidney disease, all those things, eating unhealthy, not working out, not exercising, can lead to vascular dementia. So what happens is these small vessels in our brain clog up, and then they cause many infarcts, like many strokes around the brain. And when we're in like our 40s, 50s, we may not even notice it. But then once you hit 60s, 70s, you start noticing that your memory is impaired. Your family members start noticing it. You're unable to do things you were able to do before. You're needing help with basic living. So that's what we call vascular dementia. This one is actually somewhat preventable by living a healthy lifestyle, starting like in your 30s, 40s, taking, a good approach to your health, eating healthy, exercising, keeping your blood pressure normal. Those are the things that will help prevent vascular dementia. Then another common one is Lewy body dementia. It's quite common. This dementia is caused by protein buildup as well in the brain. It leads to impairment in your mood, changes in the personality, hallucinations, psychosis. So usually if you see an older person or like your grandmother, grandfather, uncle, and you notice that their memory is off, but they also have hallucinations and they also are stumbling, walking like they may have Parkinson's disease, you want to think about Lewy body dementia. So that's when you say, hey, I need to send them to a neurologist to get evaluated. Currently, there are several medications to treat the symptoms of dementia that I mentioned, such as the Lewy body dementia and Alzheimer's dementia. However, there is not a cure currently. As mentioned before, there are some cures in the pipeline that may be available in the near future. However, they're not proven, So it's all about working on prevention. Going to see your neurologist, learning about ways to prevent your chances of developing dementia later in life. Again, I'm Dr. Pierce. I'm located in Sugar Land, Texas, at Mind Neurology Clinic. You can visit me at my website, www.mindneurology.com. I'm on Instagram at Dr. Jontel MD. And you can call and request an appointment at 281-402-9522.